thanks for joining us for another edition of the Medicare Hat Lady. This week we are going to talk about Medicare changes to Medicare Advantage plans and Part D drug plans for 2025. First, there will be a discount on the top 10 most expensive drugs. Sorry, shouldn't say most expensive. Maybe the most prescribed and expensive drugs. So Humira is not on that list. However, Eliquis is. The manufacturer's discount will be applied when you pick it up at the pharmacy. So you're not getting any money back, but the 25% co-insurance on brand name prescriptions should be lowered based on this discount. Number two, with or without a discount, every Medicare recipient will have a $2,000 out-of-pocket maximum. The $2,000 out-of-pocket maximum includes the $590 2025 Part D deductible. So say that 3 times fast. 2025 Part D deductible is $590. What will change next year, and just don't forget, I can't talk about plan specifics, but I can tell you to expect more drugs that are currently not applying to the Part D deductible to apply to the deductible in 2025. So if right now you're on a plan, whether it's Medicare Advantage prescription drug plan or a standalone Part D plan, and your drug does not apply to the deductible, I think it's a safe bet that if it's not a drug that costs $10 or less, it will apply to the deductible in 2025. I realize that $590, that's a lot of money. It's especially a lot of money if most years you just pay $25. And it's in January, which means you also have to pay your property taxes. A lot of times people pay their car insurance and their house taxes. It's just not a fun month for expenses, especially if you celebrated the holidays in December. So I'm going to give you some practical tips. Practical tip number 1. If you're watching this, I also hope you are part of the 20% of Medicare patients who read the mail that comes in every month. Go ahead and open up the monthly statements on your prescriptions. Every month, Medicare recipients receive a printout of the drugs they had filled and the cost of the medication, both how much you paid and how much your plan paid. If those are costing more than, let's say, $50 a month, I think it's reasonable to assume it will apply to the deductible in 2025. If you're worried about the $590 upfront cost in January, my number 1 tip is this. Let's spread it out. If Walgreens is your favorite pharmacy, then I recommend getting a $100 gift card every month from July through December. That way you'll have $600 in gift cards when January rolls around to pay for your prescriptions. Number 2, start playing with the dates you have to get them refilled. Assuming that you're not in the coverage gap, work on now getting a 90-day supply in July, a 90-day supply in October, and a 90-day supply in December. Getting a 90-day supply at the very end of December accomplishes 2 things. Number 1, if it's moving from copays to deductible, you're putting off the deductible until March. Number 2, no one should be in the pharmacy the first 2 weeks in January. Everyone who's in the pharmacy the first 2 weeks in January is either sick, meeting their deductible, or their insurance is not working. The girl who worked in a pharmacy in high school and college is going to tell you this. The grumpiest people in America are in a pharmacy the first 2 weeks in January. So anything you can do is better for you in the long run. So try and get your prescriptions, refills to be due the week between Christmas and New Year's. It could potentially save you a lot of money. 1, 2, 3, 4. This brings us to the next part of the 2025 changes I want to discuss today. Part of the new rules in Medicare is that Medicare Advantage prescription drug plans and standalone Part D plans are required to offer what's called the prepayment plan. The prepayment plan is going to be implemented so that the consumers and Medicare recipients can pay the $2,000 based on their drug costs over a 12-month period. You'll be notified of this new prepayment plan in December when you receive your new ID cards for Medicare Advantage or standalone Part D. So everyone on Medicare is going to be notified of the prepayment plan and given the opportunity to enroll. 1, 2, 3. A little bit about me. My first job was at Eckerd's in Plano, Texas. That's a pharmacy if you're too young to remember that. For high school and then college. I then worked for 2 different prescription benefit managers. I worked for one of the top 5 insurance companies. And in 2001, I jumped off the cliff to start my own agency. If you're wondering who K and G are, K is my daughter Courtney and G is my son Grant. Having said all that, that gives me quite a bit of experience in not only health insurance, but pharmacies and prescription benefits. Our agency survived the Obamacare implementation of 2014, and it will continue to rein in the chaos for our clients in a way that we can explain it in a clear and concise manner. In 2025, KG Health Insurance clients will be told we are not recommending the prepayment plan. We will probably not recommend it in 2026. I'm hoping that by 2027, the kinks will have been worked out and the prepayment plan is now a viable option for Medicare recipients. But in 2025, you are asking insurance companies, prescription benefit managers, and pharmacies all to work together to implement a new plan where the final rules weren't even published until last month. Everyone knows that information technology changes can be challenging. But now we're talking about information technology changes and health insurance companies and pharmacies and prescription benefit managers. It is going to be a challenge for it to work for anyone in 2025. I will not be recommending the prepayment plan for anyone. And I hope if people see this, they heed my warnings. And if you're worried about the $600 deductible in January, don't forget to play with your prescription dates so you can get refills between Christmas and January 1, hopefully for a 90-day supply if you're not in the coverage gap. And number 2, if you want to spread out that $600, there's nothing wrong with getting $100 gift cards every month at your local pharmacy so it's not as big of a hit in January.